So it's a pleasure to be here, and this mostly is a new group of people for me, and I think that's exciting. I think one of the funnest things in my career has been to meet and work with people that I haven't ever worked with before, learn, challenge myself. I think maybe a personal function of getting bored easily and needing to sort of move, keep moving. So I'm going to talk about data, democracy, and health. I'm not, again, perhaps going to present the most sophisticated data sets or the most sophisticated efforts at visualization. What I'm hoping to do is stimulate, well, what I am going to try to present is how data, whether crude or simple, and effectively and purposefully collected and targeted, has been successful in changing policy, practice, regulations, and human conditions. What this might stimulate, though, which is is how the capacity of computer science, or this institute and on all of your colleagues, can be used to better produce and take to scale some of this data. Also, I think I'm hoping to sort of emphasize the importance of actually really understanding why the purpose or the target of the data, and not simply making progress in the science, or the measurement. So perhaps this is new to you, but I think that the theory that I have been working on for a decade or more is that democracy itself is the most important prerequisite of health. And we don't have a perfect democracy here, so we have opportunity to experiment and intervene in democracy and see what the effects on health are. We have an opportunity to see where gaps in democracy affect conditions. And so I think the reasons, if you think about it, I think health is predominantly, it's not a function of any one thing. It's a function comprehensively of whether we're meeting our human needs. And democracy is a system that is intended to sort of maximize the fulfillment of human needs for the population, I think. And democracy depends on sharing of decision-making power, the free flow of relevant information, civic engagement, and responsive and accountable public institutions meeting these needs. If any one of these things kind of break down, and probably there's more, this is a pretty thin description, we will not have a working democracy, and we will not have the needs of health met. Now, public health over the past decade or two has been doing a lot of hand-wringing around what's so-called the social determinants of health. Income, nutrition, transportation, land use planning are all now called the determinants of health, and public health will has produced like innumerable empirical studies saying the determinants affect health. And so now the public health people say, well, income, that's a health issue, and food, that's a health issue, and parking, that's a health issue, and driving, that's a health issue, and everything is a health issue. And while that's true, it doesn't necessarily move things forward. Well, poverty is bad enough. We don't need, the fact that poverty kills doesn't make poverty that much worse, or doesn't necessarily change socially the motivations to deal with poverty. But what about our system isn't solving poverty? And then I think if public health wants to be an effective actor on the social determinants of health, on health, it's going to need to figure out how and why we have these disparities in the determinants of health, like income or food status, and where do failures of democracy, and again, these are intentional failures and unintentional failures, produce that, and where exactly can we intervene? And I'm going to speak, and I think there's lots of different ways to intervene. And I think but my talk's going to really focus on the nexus of information as being one catalyst to sort of improve democracy, to improve the human needs and social conditions for health, ultimately to improve health. In 2004, we began a project to create health and sustainability indicators for San Francisco. The drivers for this project were community groups saying, city, you are planning for growth that doesn't meet our needs. And people wanted community impact assessment, they wanted the prevention of displacement, they wanted affordable housing, they wanted more parks, more schools, all these things that I would call core human needs. And from the development side is that, from the planning and development side is, no, we can't do that, that's not feasible. It's neither politically or economically feasible to meet your needs because the developers say that that won't pencil out. And that's really what and so it was pretty apparent to me that our planning system wasn't working like a democratic planning system should be working. And our response as a health department was to bring all of the parties together and start to say, okay, what is a healthy city? How do you measure a healthy city? And how might we, and that process ultimately led to a set of about 90 performance indicators that were community and agency selected and community ground truth to measure accountability to growth and development going forward. And I'll give a few examples of how that deliberate data collection sort of made a difference. So here, this is a map of air pollution at a street or neighborhood level for San Francisco. This was a feasible map with existing technology. We used traffic data that we got from the transportation agency and dispersion modeling to create this map that identified areas and relative differences in air pollution. The measure we used was the measure that was being used by the state and the federal agencies in their air quality standards. And I think what's in this graph doesn't automatically tell the story. I have to talk a little bit with the map to tell the story, and that's what I'm hoping that sort of like maybe some innovation can happen here. The federal government and the state agencies have air quality monitors, and they deliberately locate these air quality monitors away from hotspots of sources of air pollution. That's a deliberate strategy in order to evaluate background air pollution levels. Well, we don't have monitors where we know the pollution is. So we should anticipate that there are going to be areas in our cities where air pollution is higher than the air pollution standard, and we're doing absolutely nothing about it, and we're not even knowing about it. In fact, it's the policy right now of our country not to know about it, at least the regulatory policy. So this map breaks through that policy by providing data to evaluate an existing regulatory standards and is incredibly in action driving. We say, oh, these red areas are in violation of the California air quality standard. Planning department looks at this map and says, okay, that's information we have to act on. Developers say, we don't want our customers, our new residential customers, knowing that these are areas out of the air pollution standards, and we didn't do anything about it. So, and this is also a manageable problem. This isn't everywhere in San Francisco has unacceptable air quality. It's a fairly focused area, and most of the areas are just right on top of freeways where we're not building anyway. So this led to the first in the country law requiring something very simple, better ventilation systems in new residences that were built in red zones. It was a feasible, practical solution and a new regulation driven by this data. Data has another pathway to policy effect of this data has been reframing. The usual way of looking at transportation injuries, because they're mapped at the by the intersection, is by the intersection. If you look at, in the background, you'll see a whole bunch of dots. I don't know if you can see those kind of light red shadowed dots. And those dots are where all the injuries are. And every intersection has an injury. And the practice of the transportation agency is to focus on the 10 worst intersections. But the problem with that is the 10 worst intersections account for 2% of the problem, or 1% of the problem, a very small, and the problem is pretty widely distributed. We reframe this by measuring injury density, not at the intersection level, but at the corridor level, so a linear density. So we just changed the measure to linear density. By changing the measure to linear density, we're able to identify 55% of the injuries occurring on 5% of the streets. And this was a transforming data exercise. The police departments said, oh, we should probably do enforcement on those streets. We should focus our enforcement there. And they did. And the transportation agency that was implementing traffic calming said, well, maybe we need to implement traffic calming on some of the arterial streets. All of the investments in traffic calming were happening in areas that were relatively calm and low injury density streets. Because that's where the public sort of demand for it was. So we're doing other kind of action forcing. So these are housing safety violations in San Francisco. I think what I can't show you is what's interesting. These are highly concentrated in certain neighborhoods. Our policy efforts, our regulatory practice, is not to target particular areas or frequency of proactive inspections, but simply to be responsive. So we respond to complaints citywide, and our efforts are spent citywide. But the problem in terms of real violations is pretty concentrated, and it's suggesting to us that we need to shift sort of the way we deploy kind of our resources. Here's a problem that we haven't solved, or I'm not sure we don't, beyond right now our capacity to do anything about. This is a map of quality educational access in San Francisco. And so briefly, it's calculated by calculating the number of available elementary school seats within a mile of every intersection in San Francisco, and then weighting those seats by distance to the intersection and the academic performance index for the school. So it's a composite of proximity and quality, and we translate it in sort of, it's a relative score normalized to 0 to 100, and there becomes a heat map. So the red areas have poor access, the green areas have good access, and all of our smart growth development is happening in the red areas. And this illustrates a different kind of problem with land use planning. Is we use transportation access as the single parameter driving where we're locating new housing. Well, the areas with the best transportation access typically have really poor school access, park access, and other infrastructure access. And we haven't balanced these interests comprehensively, either in locating new, locating growth, or providing kind of the gap infrastructure. We haven't optimized across all of the parameters for smart growth. So those were ways we've used this, I think, use data internally. And again, let me back up. I think we have this comprehensive indicator system called the Sustainable Communities Index. Many cities are very interested in replicating this. And there are limits to their capacity to do so, because collecting this data has been really a labor of love for us locally. We haven't necessarily had access to national data sets or remote sense data sets that we can pull. We've had to create the methodologies and prove those methodologies on the ground. Now, if we can scale them up through some of the techniques that we were talking about and hearing about today, more cities could have access to this kind of, I think, decision-driving information. The private sector and the new information technology sector can be a powerful partner in dissemination of information. This is I suppose, a form of visualization, since it's visual and we're looking at it. It's a number. But all cities regulate restaurants, and there's inspections twice a year, and there's a score given to the restaurant based on the number of violations. We worked with Yelp in New York to create an open data standard. So every city's collecting this data and reporting it slightly differently. If we collect it in groups like Yelp want this information in a way that they can sort of scale it nationally. So we worked to create this data standard, and we were the first city to sort of push out this data in a weekly feed. And now Yelp is doing our work in exposing restaurants with poor scores. This is going to create a motivation This is both fulfills right to know or transparency. It creates a motivation on the business owner, and hopefully it can reduce our work and go in having to work with these restaurants. So, so those are two. I mean, I think those are sustainable city performance measures, and taking regulatory data and using social media to expose it are two ways that I'm kind of going. Not only do we have food data, but there's housing regulatory data. There's all sorts of businesses we regulate. Now, I think crowdsourcing and remote sensing are going to be ways to make this kind of data, the sort of the gap data collection, more easy. But I'd really emphasize that we need to understand the theory of change that this data is supposed to be working with. I think we need to have really understand what data we are going to collect, how it's going to work in that theory of change as we go forward. So I'll stop there. Thanks.